Dr. Ismail Odetokun from the University of Ilorin, Nigeria. I'm one of the admins of the AfriScience network. Today, we'll be having our 34th webinar in the series. And today's webinar will be handled by Dr. Mary Ugalahi. The title for discourse today is Clear Sight, Bright Minds, 2020 Vision for Academic Excellence. Before I invite our erudite scholar and speaker to deliver the lecture, I want to introduce us to the AfriScience network, what we stand to do, what is our mission. The AfriScience network aims to promote innovative and multidisciplinary scientific research and development in Africa by bringing together a community of academia and industry scholars, as well as researchers who share similar goals. Our vibrant community, consisting of over 9,000 members, provides unique platforms, A to I, for innovating and improving the quality of research and development outputs, increasing collaboration among researchers and developers, and providing opportunities for knowledge sharing and capacity building. The network's mission are crucial given the challenges faced by African scientists and the potential impact of scientific research and development on the continent's socioeconomic platform. With the right support and resources, the AfriScience network has the potential to transform Africa's research and development landscape and position the continent as a global hub for scientific development and excellence. The network, with its mission to foster scientific research and development in Africa, aims to unite a diverse community of scholars to enhance research quality, collaboration, and knowledge sharing. We always emphasize the involvement of experienced academics, encourage active participation of members, and seek expansion across African countries. We emphasize mentorship, we organize seminars and collaborative initiatives. The network also envisions transforming Africa into a global hub for scientific excellence, provided we have the right support and resources. So today, we'll be having Dr. Ugalahi from the University College Hospital, Ibadan, to deliver this important lecture titled Clear Sight, Bright Minds, 2020 Vision for Academic Excellence. But before I invite her to give the talk, I want to quickly read a short and impressive citation. Dr. Mary Ogbenyi Ugalahi is an academic staff of the University of Ibadan, College of Medicine, and a consultant ophthalmologist at the University College Hospital, Ibadan, Nigeria. She earned a medical degree from the University of Ibadan and completed a residency in ophthalmology at the University College Hospital, Ibadan. He holds fellowships both from the National Postgraduate Medical College of Nigeria and the West African College of Surgeons. She was the pioneer fellow of the Pediatric Ophthalmology and Strabismus Fellowship Program at UCH and later completed a Commonwealth short-term fellowship in the same specialty at Islamia Eye Hospital in Bangladesh. Our academic journey also includes a master's in global health and a PhD focused on improving access to eye care for children. Dr. Ugalahi has authored over 50 peer-reviewed publications and has presented her research on child eye care at numerous international, regional, and national conferences. She is an active member of the Ophthalmological Society of Nigeria, Nigerian Pediatric Ophthalmology and Strabismus Society, and other professional bodies. Our advocacy work spans both clinical and community settings, with a strong focus on expanding access to eye care for children. Dr. Ugalahi loves writing and has written 2 books on health literacy titled Fireside Chats with Dr. Mary, volumes 1 and 2. She's also an avid writer on social media and can be followed on Facebook and Instagram through her handle at Mary Galai. Dear all, permit me to invite Dr. Galai to deliver this wonderful presentation. Thank you very much. Over to you, Doc. You can share your screen while you deliver your presentation, ma'am. Great.
Okay. Good morning, distinguished ladies and gentlemen. I'm glad to be here this morning, and I thank you for the opportunity given to me to have this talk with us. I'll briefly show my face so that you know what it looks like in case you see me on the street. You'll be kind to me. So, is the face showing yet? I don't think so.
Not yet. Oh, yeah, we can see you now.
Okay, right. So if you see me on the street, be kind to me. This is me. All right.
Thank you very much.
Are the slides showing?
Yes, they are showing, but I think you need to put them in the presentation mode.
Yeah.
Yeah.
All right. So I've been having a lot of technology challenge this morning, but I think we can still go ahead. So my presentation is on Clear Sight, Bright Minds 2020 Vision for Academic Excellence. And I'll be using this outline to try to put things in shape. So what's Vision 2020? Vision 2020 is the ability to see it all. And it's not just about acuity. Acuity is, okay, I'm standing, I can see things at a distance or at near. But Vision 2020 goes beyond that. It also talks about the quality of the vision you see. So first, we start from the vision acuity. Normal vision, we should be able to see when we want to read a chart in a 20-feet room or in a 6 meters room. You should be able to read all the way to where the red line is on this chart by my left. I don't know if you see my cursor. So we should be able to see the chart all the way to the left. So that says that when you stand at 20 feet, you should be able to read what every other person, what majority of people will read at 20 feet. So anything below that is subnormal. Then we also have to talk about near vision. For people who are in academia, near vision is quite important because you do a lot of near work. So near vision is ability to read the near chart at about mid-arm length. The first 2 lines on this chart are what is expected to be able to be read clearly, usually newspaper print. And as we go on, we'll see that it gets to a stage in life where we have difficulty reading those tiny prints. Now, as I said, not just the quantity, but quality. So further quality, ability to appreciate color. The world is full of colorful things, and normal vision also involves the ability to appreciate color. For those who work with color coding and in safety areas, even when you're driving, you understand that it's important to appreciate colors, because red on the traffic light means stop, green says go. And if you have difficulty appreciating those colors and you've not really have cues to say, if they are not placed exactly the same way at every traffic stop, you probably have some difficulties driving. And this has been shown through studies that people who have poor color vision appreciation can have challenges. Then we move to contrast sensitivity, and that speaks to ability to recognize fine details when you look at things. So if you look at this picture on the right, there are 2 images being displayed. One is clearer than the other. Someone who lacks contrast sensitivity is not able to appreciate the fine details, the contrast between words, the details on people's faces, and all of that. And that poses a challenge on its own. Then, of course, it involves how wide we can see. So a wide field of view, you should be able to see things when looking straight ahead. You should be able to see things that are on the floor or below. So if there's movement, for example, you're moving and a reptile probably moves across your path, you should be able to see it and avoid it. And to your side, which is required for driving and all other things, you should be able to also see movement at your side. So it's not just the things straight ahead that we need to see, because for acuity, it's just about the things straight in front of you. But your visual field, the peripheral fields, are also important because they help you to navigate through life. Then ability to look at things in 3 dimensions, to perceive depth of things. And this is very important because people who lack this occasionally experience pass pointing. You can't hang close on a line. You can maybe want to pour water into a cup and pour it away because such people lack the ability to appreciate depth, and that's where stereoacuity comes in. And for anyone to have this, the 2 eyes need to work together, because binocular vision can only occur when both eyes are working in tandem. So having said that about normal vision, what does the data say about vision impairment? Right from time as far back as in the 80s, the Baltimore Eye Survey, which was one of its kind back there, actually showed that there are racial differences in vision impairment, with people of Black race having more of the problems than people who are not of the Black race. So these racial differences occur, and it's not just because of the genes, because although the genes put us at risk for some eye disease, as we go on, I'll talk about that. But in terms of availability of services, of people wanting to use these services.
Wash white. The other bathroom. Usually wash color. Because I don't know to buy.
Please, can we mute ourselves? Khadija.
Okay, that landmark study back then also found that prevalence of vision impairment increases with age. So as we grow older and we pray for long life, we also have to contend with some of these things that cause vision impairment, either because they are age-related or age actually potentiates some of the problems that will lead to vision impairment. Now, we also had a Nigerian National Blindness Survey, which is also the first that has ever been done in Nigeria. And studies from this data from this study show that prevalence also increases with age. So the older age group had a higher burden of vision impairment. Some ethnic groups in Nigeria were at risk of some kind of blindness from some diseases. Example, glaucoma. It's said that people of Eastern extraction had more of blindness from glaucoma, and possibility of genetics was noted, but that needs further studying too, and there are studies going on genetics of glaucoma in Nigeria. It also showed that women had a higher burden of vision impairment due to so many reasons, social reasons really, because they probably need permission to access eye care and the lack of independence in some cases. Also, literacy rates. The better the literacy rates, the lower the vision impairment and blindness. Geographical location, Southwest Nigeria is said to have the lower burden of blindness, and it's not so uncommon because even when the mapping of eye services that we've done in Nigeria has shown that majority of eye care workers are in Southwest Nigeria. So that's expected that if there are more services, then people are accessing them, and that reduces the prevalence of vision impairment and blindness. Then the World Report on Vision, which is a periodic publication, also corroborated all of what I have said. And it also tells us that majority of vision impairment and blindness in developing countries like ours are due to avoidable causes. In other words, these causes can neither be treated or prevented. And so just an intervention, either a public health intervention like this talk, or screening programs, or availability of surgical problems or eye care services can actually prevent most of the vision impairment we experience here in Nigeria. So the common causes of vision impairment and blindness, we have uncorrected refractive errors, which is the highest, and presbyopia. Then cataract, which is a treatable cause of blindness, is reversible. Glaucoma, which is a preventable cause of blindness, but blindness from glaucoma is irreversible. The good news is that blindness from it can be prevented, and as we go on, I'll talk about how we can do that. Then age-related macular degeneration has also been shown to contribute to blindness in the world, more in advanced country than us, because we still are battling with avoidable causes of vision impairment. Then corneal diseases from ocular injuries are also common things here. Before, it used to be due to vitamin A deficiency, but thankfully that is not really much on the table again. But ocular injuries actually taking up that space now, and that has to be addressed. Other things like trachoma, which also caused corneal diseases, is also on the decline. Then things that are coming up related to non-communicable diseases like diabetic retinopathy is the incidence of diabetic mellitus increases, people are getting more at risk of having diabetic retinopathy, and people are actually having diabetic retinopathy. So that's coming up. And other things that sickle cell retinopathy, Nigeria being one of the countries with the highest rates of people who have sickle cell, is also on the table. So I would continue to talk about some of these things now as we move on. So briefly, we'll talk about refractive errors. Refractive errors include myopia, which is being someone who is short-sighted, someone who can see things around them, but they really can't see things that are so far off. Hypermetropia, another form of refractive error, and then astigmatism. Now, globally, it's been said that uncorrected refractive error is the leading cause of vision impairment world over. And it's surprising because this is something that can easily be corrected with a pair of spectacles, but it's still out there that people don't have access to getting these corrective measures. So my focus this morning will be more on myopia because this is more, our demography is more of people who are a bit older than 20. Usually myopia starts in adolescent age, by early teens towards early 20s. Most people who will be short-sighted already will be short-sighted at that age. But sometimes people develop myopia in adulthood. So adult onset myopia usually may signify a lens problem. The individuals probably developed a cataract. So sometimes we hear people say, oh, I see clearly. And then you ask for that. How do you see clearly? So I can read. But do you see people who are coming from afar? I say no until they get close to me before I can see them. In fact, I just got an 86-year-old man yesterday to have his refraction because he told me he sees clearly. And I said, okay, let me test your vision. And I discovered that he could read. So he was satisfied just because he could read, but he can't recognize people. And this vision impairment can put people at risk of fall. So we had to get him corrected yesterday, but it was because he was developing cataracts. So adult onset myopia is something worth checking. Another thing that can cause an adult onset myopia is diabetes mellitus. So some people get diagnosed the first time because they discover that they become short-sighted. And usually when the blood sugar is high, it can cause a kind of myopic shift. And then the person discovered that I've thrown my glasses away. I don't read with glasses anymore. Now I can read without my glasses. And if that's happening in adulthood, it's important to go for a health check to be sure that you don't have such an individual doesn't have a problem with sugar metabolism. So that's one thing I want to point out about short-sightedness developing in adulthood. The other thing I want to talk about is that, okay, if you've been short-sighted all your life, and it's important to know that in some individuals, this problem progresses, and it progresses, the eye continue to get enlarged, what we call a progressive myopia. The eyes continue to get bigger, and this stretches the back of the eye so much that the retina starts undergoing some kind of changes. And so it's important to screen, to have a dilated eye exam to be sure that the retina is not having problem, because it can sometimes lead to development of holes in the retina, or a retinal tear, which can lead to detachment of that structure, and this can eventually lead to blindness. So that's one thing. Then studies have also shown that people who are short-sighted are at risk of developing open angle glaucomas. And so these are things that if you do wear glasses for myopia, you should endeavor to have a screening for these two things to be detected. Some ocular changes are due to aging. Age is a beautiful thing, but as the body grows older, some changes occur. And these things are more like physiologic, some of them are physiologic, some of them become diseased condition if they are left unattended. So things like presbyopia, inability to read near, it's an age-related change in the eye. Age-related cataracts, age-related macular degeneration, and posterior vitreous detachment. So presbyopia it usually starts at about the age of 40 years, but it's been described to start earlier in Africans. And back then, when people didn't really do much of reading, nobody was wearing glasses. But it's interesting to know that you also need your near vision for things like picking beans and all of that. But those women back then or older people back then were coping somehow. I have a story to tell of a PhD student who came to me and told me that I'm blind. I said, why do you say you're blind? So she was eating, and her son came in and said, oh, why are you eating food that has ants in it? And she said, ants? I can't see the ants. And the son said, no, that food is not good for you to eat it, and collected it. So she was really worried and came and said, I'm blind, I can't see. I was eating food and someone said that the food had ants in it. So I said, no, you're not blind. You are just aging nicely and your eyes are aging along too. So that's why you had difficulty seeing tiny things. So symptoms actually for presbyopia, they have difficulty reading tiny prints, and sometimes they have to move the book or whatever it is they want to read. They keep moving it because the near point of accommodation is receding. So they keep moving things further and further and further, and you actually see them, they hold their phone at arm's length to want to read it. Some will push their laptop a bit back so they can see, or you increase the font size so that it gets bigger and they're able to read. But it gets to a stage that it gets difficult to do all of that, and that's when they seek help. They also may discover that you're needing more illumination to read. So when you wake up in the morning, on waking up in the morning, it's difficult to see what it is that you want to read, and you're looking for light. You start redecorating the house, putting a bed lamp, and all of that is not it's not really a problem so much. It's presbyopias and all that is required is to have a refraction and have an optical correction. There are also some new things coming up, eye drops that are being said to help with presbyopia, but well, the patients will choose what is most comfortable for them to use. Optical correction is usually the most readily available. And the thing about presbyopia is that when you've developed presbyopia and you have your eye check, I will advise that you request not just for for spectacles, but that you should also have an intraocular pressure measurement at that eye exam. Age-related cataracts. So just as the hair grays, the lens of the eye also goes gray. And it's important to know that lens fibers form all through our life. And so the lens will get bigger. As the lens in the eye, it get bigger. And then it can also change. So the colors start getting opaque just as we develop gray hair. So visual loss from cataracts, age-related cataracts, usually starts about the age of 50 years. Any cataract that onset is before 50 years is usually maybe linked to some pathology. But cataract occurring before the age of 50 years, most often, is just age-related cataract, is physiologic. And visual loss usually is painless, and progressive. So there's this gradual blurring of vision. In fact, my own mother told me that she just sees cloudy, like she's looking through a harmattan haze when she started developing cataracts. So I understand and it was really quite bothersome. So you just wake up in the morning and everywhere is looking like it's harmattan, but it's not harmattan. You're not seeing people clearly. Also, driving at night becomes difficult. There's glare. Especially depending on the kind of lens opacity, there can be glare. So light scatters, and some people abandon driving at night. They can't drive at night anymore. And if you're the type that works till late, I have to leave the lab or you have to leave the office late at night, and you're having glare that is really so uncomfortable, it actually can impede on work. And the difficulty with vision can affect both near and distant, depending on the kind of cataract. Also, there may be some poor contrast sensitivity, so details are not clear. And as I said earlier, adult onset myopia, there's some nuclear sclerosis can cause short-sightedness, and of course, a white speck. Some people may notice a white speck. Some people may never notice a white speck. So what about age-related cataract? It's a treatable cause of blindness. Just requires a short surgery, usually max 30 minutes. Depending on the kind of surgery that is being assessed, can be a phaco, the so-called lens laser cataract surgery, or it can be a small incision cataract surgery, and vision, such an individual have their vision restored after the cataract. So developing a cataract is most time when it's age-related is just like having gray hair. Age-related macular degeneration. The macula in the eye is what is responsible for that central clear vision. So when we're looking at people that we can observe their features in details, is because the macula is functioning. But as people grow older, sometimes the macula thins out. And so that's degeneration that occurs with age. It usually affects people over 50 years, and it's a common cause of vision loss. But as I said, more common in developed countries where they have taken care of things like cataract and the other preventable causes of blindness. And most people will describe to you that when they are looking at things like this picture that I've posted here, someone with normal vision should be able to see the center of their focus, which is the young lady, and she also have peripheral vision, seeing all the other things. But in an individual with macular degeneration, what they are focusing on, what they want to look at, it looks like there is something across it. So that's what we call a central scotoma. So that is not clear for them to see, but their peripheral vision, because the peripheral retina is working. The macula is the center of the retina, is the one with the problem, but the peripheral retina is working. So they're able to see things around, but they can't see the center. Some will even describe to you like, oh, when I look at people's faces, I will see their face, but I can't see the nose, or I can't see the eye. Okay, so such details are what's usually being described. So if anyone observes such a problem with their vision, it's important to have it checked early. So there are some known risk factors for age-related macular degeneration. Not everybody will have it. There are some people who are at risk of having it. People who are overweight or obese. So generally, having a controlled weight is actually advantageous because it's not only for the body, it's not only for the heart, it's not only for the kidneys, but it's also for the eyes. So having a controlled weight is good for your eyes. People who smoke tobacco are also at risk of this. And I must also point out that this is an academic environment, so I'm sure that we understand that shisha is also tobacco. So whether it's a tobacco cigarette, a tobacco roll, or whatever, or is tobacco passed through water like shisha, is all smoking. So people who smoke tobacco are at risk of many things, including eye problems. People who eat food high in fatty diets, so they're always frying and taking a lot of fatty diets, such people can be at risk. people with hypertension, people who have their lipid profile being distorted, and if there's a family history of age-related macular degeneration. So what can be done to reduce the risk of this is to address all these risk factors that I have identified. Lose weight, do some exercise, stop smoking if you do, increase fat intake, because antioxidants are quite important for the health of the retina. And if you take high food rich in vegetables which have antioxidants, they actually improve the eye health of such individual. And then have an eye check once you get into the age at risk, so that if it's there, can be detected and monitored. Another type of age-related eye change is posterior vitreous detachment, and it actually happens when there is degeneration of the vitreous. The vitreous is a gel-like substance in the eye that keeps the shape of the eye. It provides nutrition to the lens and all of that. Is between the lens and the back, the retina. So it actually gets liquefied as we grow older, and by the age of 50 and above, people start experiencing, because it's becoming liquefied. Some places are liquefied, some places are firm. It's like, I describe it like you make pap in the morning, it has the same consistency, it's thick, and then you come back in the evening to see the pap. You actually observe that some part of the pap is thick, some part of the pap is watery. So that's what happens to the vitreous as we age. And so it can, because it has a firm attachment to the retina behind, this liquefaction leads to its detachment. And so the detachment can sometimes lead to vision loss, but in most people, it may just detach and nothing else. It doesn't cause anything. But people get bothersome when they start seeing, people get bothered rather when they start seeing things like floaters. So floaters are things that when you are looking at someone, you are seeing black specks. Some have described it as seeing insects in their field of view. They try to kill the insect, but they cannot get them. And as they keep moving their eyes, they keep seeing those insects moving around in their field of view, dark spots. So that's what is most bothering about it. It usually starts with seeing flashes. So flashes are like seeing stars. If as we used to say that somebody was slapped and the person saw stars. Yes, that happens if the slap was so bad that the vitreous moved and pulled on the retina. So it caused photophobia and person sees stars. So that's what flashes look like. And because flashes and floaters can also be a symptom for retinal detachment, it's important that if anyone observes that they're having flashes, they're just sitting and they see as if light is blinking in front of their eyes, flashes, tiny stars, or they are seeing these floaters that I've just described, dark spots in their vision, it's important to have an eye check. Most times it's just posterior vitreous detachment and we wouldn't do anything about it. If the retina is okay. Most posterior vitreous detachment does not cause vision loss. So if an individual is having flashes or floaters and then observes that maybe there's a field loss or there's a vision loss, it's very important to have an eye check immediately, because that may be a sign of a retinal detachment. The vitreous detachment didn't go well and it pulled the retina along with it. And the thing about it is that retinal detachment is treated, but the best outcome of surgery happens when it's treated early, because the retina needs to be attached to get adequate nutrition. So if it's not treated early, after surgery, if it's treated quite late, the outcome is usually poor. Then something I'll be talking about again is glaucoma. Although it's not age related, anybody can have glaucoma. Glaucoma can happen in babies, can happen in young people, it can happen in old people. But it's important to know that aging is a risk factor. Like I said in the data about vision impairment, as we grow older, we are more at risk of developing some of these eye conditions. So glaucoma has been described as a thief of sight, and that's because the vision is usually affected before the individual may know that I have glaucoma. And the sad thing about it is that central acuity is usually good. So people say, I can see everything, I can read everything, I can see people far. But as the disease usually affects peripheral vision, okay? So it takes someone who is very observant to observe that their peripheral vision is being lost. And it starts early, there is loss, and progresses until there is tunnel vision. It's often painless, and left untreated, it progresses. The other risk factors for glaucoma is people of West African of West African extraction are said to be disproportionately affected, and that has been linked to our genetics. People who have elevated intraocular pressure. So if you've had an eye check before and you're told that your intraocular pressure is reading above 21, even though you were told you didn't have glaucoma, it's important to keep checking. People who are short-sighted, people who have a family history of glaucoma, people who have either very small eyes with crowding of the angle structure are also at risk of developing glaucoma. People who have used corticosteroids, some use corticosteroid either things like prednisolone, dexa, or whatever, either through their creams or they swallow, they are taking it, ingesting it for some other ailment or for some other things. They are using it as nasal spray for maybe allergies. So the use of corticosteroid through any route, or they've used it as an eye drop or some other treatment. Such individuals may actually be at risk of developing glaucoma. People who had injury to their eyes, especially blunt trauma, need to have an eye check periodically because they may be at risk of developing secondary glaucoma. So all the fonts in red are usually lead to secondary glaucomas. And people who have chronic ocular inflammation, like maybe they are being treated for uveitis, they are at risk of developing secondary glaucomas. People have had ocular surgeries before. So if you've had a cataract surgery in the past, retinal surgery in the past, such may be at risk of having secondary glaucomas. So now that I've said that most glaucomas are painless, they don't have symptoms, it's a silent thief of sight. How do people now know that they have glaucoma? Screening is what is advocated for early diagnosis. So if you're in West Africa, I would advocate that by the age of 35, at least you should have an eye examination, a detailed eye examination. If you have a family history of glaucoma, you should have a detailed eye examination earlier in life. And where should you screen? You can go to any eye hospital and ask for screening. Just say, I want to screen for glaucoma. And if that facility is able to screen, they screen. But if they're unable to screen, they should be able to refer you to the right place. And also, we can do opportunity screening. So usually every year we have World Glaucoma Week, which is usually in March or so. It's a whole week dedicated to advocacy and awareness, creating awareness for glaucoma because of how important it is to the epidemiology of blindness. So if such things are happening around you, it's actually important to make use of such opportunities. Sometimes they are in the staff health clinic, sometimes they are in the teaching hospital, sometimes they're in the communities. So such times are good to have an eye check. We also have annual World Sight Days, which is usually second Thursdays in October. That is fixed. And so you can also listen. Most times such arenas are able to do screening for glaucoma. And if you happen to follow, you have a family member who is on who's receiving treatment for glaucoma, you can also go for family screening. So you can go for as a first degree relative to have screening. And that has actually been found to pick people who didn't know they had glaucoma, but just because they came with a family member who is receiving treatment for glaucoma and they were screened, they probably will be found that they have glaucoma. So such opportunistic screenings are also very useful and can be explored, even if your healthcare plan does not factor in annual screening of your eyes for glaucoma. But if you have a health insurance that provides such services, it's important to avail yourself of such opportunities and have an eye check. When you want to change your glasses, for your reading glasses, which is usually about every 2 years, if you're using reading glasses, you should also ask for screening for glaucoma, because as we add our years in numbers, sometimes we also are at risk of developing these eye conditions. There are some ocular changes that are due to systemic illness, and diabetes is one of them. Diabetes mellitus, the incidence of diabetes mellitus is on the increase, and so is that of diabetic retinopathy. Also, hypertensive retinopathy sometimes put people at risk of having eye problems, sickle cell retinopathy, some medications, and autoimmune diseases. So diabetic retinopathy has said that can occur due to uncontrolled diabetes mellitus. So if someone has been diagnosed and the sugar is not controlled, the blood sugar hasn't been controlled, such an individual is at risk of developing a diabetic retinopathy. And only screening can actually detect it early and treat early too, because by the time the individual is experiencing vision impairment, it means that the person has either bled into the eye or there's some form of edema, and the outcome is usually a bit challenging. So when do we advocate screening for people who have diabetes mellitus? At first diagnosis of diabetes, such an individual should be referred to have an eye examination, because it's said that type 2 diabetes may not be diagnosed early because people don't know they have it and they haven't been checking. Unless you check your blood sugar frequently and you know the precise date that it went up. But because people don't know when they have diabetes mellitus, the first time they are diagnosed, it's possible that the disease has been there for a while. So such an individual should be referred as a matter of importance to have an eye examination, a detailed eye examination. And after that first examination, it can be scheduled as required. What will be done at this eye examination is to look at the back of the eye, because the diabetes affects these vessels at the back of the eyes, and it can cause them to leak. So they can leak blood, they can leak fluid, they can leak blood content into the eyes and then affect vision. So it's important that they have an eye examination looking at this. It's also very nice now that with artificial intelligence, some cameras are being developed that have the ability to screen and look at predict people who may have diabetic retinopathy along the way. Well, I'm hopeful that such technology will come up. The most important thing in the whole of it is that the blood sugar must always be controlled. Hypertensive retinopathy is another one, uncontrolled hypertension. And what uncontrolled hypertension may do is to affect the vessels in the eye, and sometimes it can lead to occlusion of vessels. And so this occlusion of vessels can cause bleeding into the eyes, and such individuals may lose vision. It can also affect the perfusion of the nerve, the optic nerve in the eye, which can lead to loss of vision. And so that's why it's important to have good control of systemic hypertension so that the eyes are spared. So we should have a blood pressure check at least once a year to be sure that your blood pressure is controlled. And for academics who work very hard, sit long hours and all of that, it's important to have your blood pressure checked. Sickle cell retinopathy is an overlooked cause of blindness previously, but we are actually coming to realize that it's a significant cause of blindness in our environment, because we know that the prevalence of sickle cell is high in Nigeria. And what happens here is that there's usually hypoxia, which is general in the body, but also affects the eye, because the eyes have blood vessels, and this can lead to new vessel formation in the eyes. These new vessels can lead to formation of tractions and can now cause either the new vessels will bleed, leading to a vitreous hemorrhage. So the first time the person may know is they have a sudden loss of vision because they bled into the eye, or it can lead to retinal detachment because that's healing and scarring can cause traction. So people who have hemoglobin SC are at highest risk, and so it's advocated that if you have any of the hemoglobinopathies, whether SC, SS, or AC or AS, at least you should request for an eye exam. So also look at the retina. And I put this picture here in case you've not had this kind of instrument being used to look into your eye. You should please request for it if you have these genotypes that I've listed, because this instrument actually looks at the peripheral retina where the problem is. And so such an eye examination must be done for you to make sure that there's no risk of sickle cell retinopathy, because if it's detected early, just a simple laser intervention can actually prevent visual loss. I'll briefly talk about atopy. Ocular allergies is on the rise. It depends on some people who have asthma or some atopy in the body can have ocular allergies, and this needs to be treated because the constant rubbing can actually modify the shape of the eye and cause some other problems. So if you have ocular allergies, I would advise that you have proper treatment to prevent yourself from itching. Now, people who use corticosteroid through any route, as I've mentioned before, can be at risk of developing glaucoma or corticosteroid-induced cataract. Anyone who has been placed on anti-tuberculosis medication, especially ethambutol, can be at risk of having an optic neuropathy. So it's important to ensure that an eye examination is done. People who are on drugs for mental health, like phenothiazines, can also have problems with their vision. They can also develop cataract. And so if anyone is on medications like that, it's important to have an eye check. Recreational drugs, people who abuse substances are actually at risk of having eye problems. Now, anti-malaria, although we have shifted from chloroquine to now combined medication, the ACTs, some people still take chloroquine. And some people are on hydroxyquinine for other problems like systemic lupus erythematosus. So anyone who is on this medication, chloroquine, and has taken it frequently, you know, some people say, it's only chloroquine that cures my malaria, and then they keep taking it and taking it and taking it. There is a dose that, if exceeded, can lead to eye irreversible damage to the retina. So chloroquine is something that can also affect the eye. We're seeing a lot of chloroquine retinopathy before, but I'm not sure how frequent we are seeing them now since I've left retina. Autoimmune diseases, things like sarcoidosis, rheumatoid arthritis, and myasthenia gravis, and other things that can actually lead to eye problems. Sometimes the first time they are diagnosed is in the eye clinic. And so things that they can cause chronic inflammation in the eye, uveitis. Sometimes they cause an inability to move the muscles of the eyes. And I've sent people from my clinic to rheumatology clinic just by presenting with this inability to move the eyes. Drooping of the eyelids may be one of the first signs. So if someone notices sudden drooping of the eyelids, it's important to have it checked. Somebody is having double vision, just sudden onset double vision. It's important to go and have it checked. It may be due to one of these systemic diseases. And if the eyeball seems to be bulging, then it's important to go have an eye check. Occupational hazards. Some of the scientists, we work in the field, we go to the field to do things in the field, and these are some of the things that may lead to ocular injuries. And it's always amusing that sometimes I see people, they'll protect everything but the eyes. And even in the laboratories, ocular injuries can occur. Dry eyes, computer vision syndrome, and all of that. So I'll talk about a few of them. Computer vision syndrome is something that is becoming common, or it's also called digital strain. And I know now that sometimes some people work with 2 laptops. They say they are maybe they are coding or they are doing a lot of IT or stuff, so they work with 2 or 3 or 4 laptops. People work from home now, so this what they call them virtual work or something. So they are at home and they are always on the system working because they are not working from the office anymore. And there's a lot of research, so you spend long hours working on the system and all of that. All of this can lead to digital strain. And so what are the things that people experience? A lot of discomfort, gritty sensation in the eye, sometimes ocular aches, and accommodative spasm causing sometimes a shift in their vision. They discover that their vision blurs for near, blurs for distance. They are having all of this. So what's been advocated to reduce digital eye strain is to practice good visual hygiene. So it's advocated that when you have worked for every 20 minutes, you've worked on your system, that you should take a 20-second break. And what do you do with the 20-second break? You should look away from your system 20 feet away. Now, what I can also say is that if you are also working in a place where you can stand up just briefly for 20 seconds and sit back. That way, your accommodation relaxes and digital strain is reduced. The ocular injuries can be of any form. They can be blunt ocular injury, they can be penetrating. This is common with people maybe who are working out on the fields. And then chemical injuries for people who work in labs. I've had a few patients present with chemical injuries when they were working in the lab. Thermal-ocular injuries also in the lab, and it can actually affect the eye in a very bad way. So what should be done to prevent ocular injuries is to have appropriate gear for work. So if you're going out and you're protecting your hand, protecting your nose, you should remember to protect your eyes. If you have a lab, the lab should have good illumination, and there should be standard operating procedures in all laboratories so that everybody, including schools, as they are coming in, you should have the appropriate shoe to wear, the appropriate eye protection, the appropriate cloths to wear for the lab, for the kind of work that is to be done in that laboratory. So ocular injuries is actually cheaper and is better than having ocular injuries, because some of these ocular injuries are actually very difficult to manage, and they can lead to irreversible visual loss. There's something I want to talk about, which is a congenital color vision deficiency. It's not something we talk about a lot, but it also puts people who have it at difficulty of work. And so normal vision, people can appreciate all colors, but there are people who are unable to either appreciate green or appreciate red or appreciate color in the blue-yellow spectrum or appreciate no color at all. The prevalence is about 2% to 8%. For Nigeria here, our prevalence is less than 4%, and males are more affected than females. It's in a study that we did, we realized that it affects activities of daily living, and that includes research. And there's this story I always tell of someone who came to me, and he said he had been to so many hospitals. He said he can't see. I said, why can't you see? He said, oh, where I work, they say I can't see because I'm a safety officer, and I have to, the color change tells me when to say, oh, things are going bad and things are going good, but I never see it. And the alarm rings before I know that something is going wrong. And everybody keeps saying that I can't see. And I said, can't you appreciate things? He said he can see people and all of that, but he knows that there's something wrong with his vision. And so we just had a color vision test and realized that the problem he had was a color vision deficiency. So counseling and asking if he can be reallocated to another place to work may actually help such an individual. So in essence, it's just that it's important. People who are going to work in areas that involve the use of colors as indicators, even sometimes in healthcare, the use of color is important for things like you are doing a urine test, a urinalysis, if it's not the automated one, and the color indicators will tell you what's going on and all of that. So it's important to have a color vision check, especially if you're a man and you observe that you are not appreciating colors very well, because these things can affect activities of daily living and it can affect the kind of work we do. So having said all of this, how do we take care of the eyes? Vision hygiene. Vision hygiene generally means you read in a place that's well illuminated, just as body hygiene says you should take your bath, brush your teeth, and all of that. Vision hygiene also says that you should read in a place that had good lighting and you shouldn't abuse your eyes. So, and you should not watch television in the dark, you shouldn't use your phone in the dark. So all of this is about vision hygiene. Digital hygiene, resting from the computer when you've used it for a long time. So 20 minutes of work, 20 seconds of rest, and look 20 feet away. That helps. And not using the computer excessively for hours without taking rest, because it affects the accommodation of the eyes, and it also causes evaporative dry eyes. Sun protection, this is not something we practice a lot here. In fact, people, you wear sunshade and then people are asking you that, what are you wearing? Why are you wearing sunshade? But sun protection has been shown to have some impact on eye health. It contributes to reducing age-related macular degeneration, contributes to reducing the risk of having cataract early. So we should protect our eyes from the sun, and so we should use sun protection. We should wear glasses or wear wide brim hats when we have to go out. Now, what I want to talk about this is that, should you use dark glasses from vendors on the street? It depends. And why do I say this? If such a vendor has the facility to be able to measure the ultraviolet rays protection of that dark glasses, then you can buy. But if they don't, what happens is that when you wear dark glasses, your pupil dilates behind the glasses. And so if such lenses are not, they don't have UV protection factors, and you just wear it, the pupil dilates and you're actually taking in more sunlight than you should. So that's what is that's the only thing I'll talk about there. Then protective eyewear. As you protect your body to go to the field and to work in the laboratory, please do not forget to wear protective eyewear. Healthy diet, I cannot overemphasize that. It's good for your body health, is good for the eye health. And then having a scheduled eye examination is important as we research and as we grow older. So in conclusion, I say that vision impairments are associated with reduced quality of life and productivity. That has been found by research, and we know that the worsening the worse the vision impairment, the worse the quality of life. Vision screening and early intervention are the key things to prevention, and we should remember that we need clear sight for the clear minds to have an excellent academic career. Thank you very much for listening. I'm grateful.
Wow. Thank you very much, Dr. Ugalahi. That was great. Great presentation, great slides, and great delivery. I'm sure the participants, the audience would have some comments and questions to ask you. So I want the audience to raise their hands. If you have questions, if you have comments to pass, then we'll take them one after the other. We have some time to take questions and comments. I can see, is it Professor Igbokwe? Okay, Ogbenyi Igbon, please unmute yourself and ask a question or your comments. Ogbenyi, yeah, please go ahead. You can unmute yourself and ask a question. Okay, stop sharing.
Okay.
Yeah.
Good morning.
Good morning.
Thank you very much for this opportunity. I want to thank Dr. Mary for this beautiful presentation. And this presentation is coming at the right time. And it has really opened our eyes to a lot of things that we take for granted. I wanted to ask a question. I need clarity. I normally have this condition whereby maybe I will imagine that something is itching me, or maybe something is actually itching me. And then I may, in my head, I'll maybe imagine that it's a mosquito or something. And then when I try to take my hand there to hit the mosquito or so, my hand will drift to another place. So I have been wondering that is this kind of thing, is it something that has to do with the eye or with the brain? It may sound funny, but it has not been so funny with me. I keep imagining, I say, this kind of situation, am I to go and see an eye doctor, or am I to go and see a neurologist, or why is it like that? So I'll be happy if I get an answer to that.
Thank you very much. Dr. Mary, do we take some of the comments, then you respond, or you give your response as they ask?
We can take some and I'll respond because
Okay, then let's take the second one then. Surajo Yaya Ibrahim, please unmute and speak.
Hello, good morning, Ma. Uh, I am Suraj Yahya Ibrahim from Kano State University of Science and Technology as a former name, which now is Aliko Dangote University of Science and Technology, Kano. I will use the opportunity to thank Dr. Mary for this beautiful, wonderful, and I don't know how you are going to call this presentation. We are happy for that presentation. And I will use the opportunity again to thank the organizers of that programs. They do it in the right time at the situation where the people need it, especially in an academic environment. I just raise my hand to thank you, to also encourage you to continue doing these programs. It will encourage, it will assist us as a learner. Thank you very much. Thank you very much.
Thank you for your comment, Ibrahim. Then we'll go to the next person, Nkiru Obuji. Please unmute and speak.
Okay, good morning, everyone. I'm Nkiru Obuji from Akanibian Federal Polytechnic. It's concerning a glass I got recently from the hospital. So after I got the glass, I noticed that I could hardly read with it, but I can see, like when I'm moving on the road, I can see to a far distance with it. But then I can't read from the screen with it, and I can't also read texts on print on books with it. So there was a doctor I met, and she was saying something about reading index, and I didn't really understand her. So I wouldn't mind if the doctor in the house can help us throw more light on what she meant by that and why I can use that glass for seeing and for reading as well. Thank you.
Thank you for your question. Dr. David Adisa.
Yeah, good morning, everyone. I want to appreciate the presenter. It was a good presentation. I enjoyed every bit of it. My question is, what could be wrong if I'm feeling my eyes are heavy and I feel as if there is pepper in the eyes occasionally, and when I gaze on the screen for a very long time, it appears blur. Why? And it later clears up. Thank you.
Thank you for the question. Dr. Mary, do you want to respond to the first three?
Yes, please let me so that I don't forget.
Yeah.
Okay. So my sister just asked me a question, very funny, and I think we are going to have a village meeting to answer this. That's Dr. Ibu. She said, mosquito, should she see a neurologist or an eye care? Actually, I think that it's a posterior vitreous detachment you probably have had, but it's still important to have a detailed eye examination. When you have that detailed eye examination, if the neurologist think, if the ophthalmologist think you should see a neurologist, then you have to see one. So we'll start from the eye. And I think it's probably a posterior, the floaters I was describing, that's what you're having. Then, thank you, Dr. Ibrahim. I am grateful. For spectacles, okay, you're not able to read with it. Two things I'm thinking is either that you're not giving the right near correction. So you were giving a good distant vision correction, and that's why you're able to see clearly at distance. But the near correction is either an ad was not given, or if an ad was given, it's not appropriate for you. The ad is not what is required, and that's why you're having problem reading. So you need to have another refraction, and they have to take, they have to do for both distance and a near correction. I can't ask you your age, but let me just assume that if you are close to 40 or you're older than 40, then you certainly need an ad. So you should find out from the person that gave you the glasses, whether there is an ad and if the ad is appropriate for you. Because before you even leave the refraction venue, they should actually check if you can read with your glasses. So and it's not exactly one size fits all. It depends on your visual needs. If you want to use it for more of computer, then it's an intermediate need that you have, and that should be addressed. So heavy eyes, pepper occasionally, blurry vision on screening, sounds like digital eye strain. And the pepper sometimes, because when we stare at the computer a lot, we don't blink as often as we should. So there's evaporation of the aqueous component of the tears. So people who use laptops a lot are a bit predisposed to dry eyes. And maybe you work in an environment where you have an air conditioner that further dries your eyes. And because you're staring, you are doing near work for a long time, your accommodation is in overdrive. And when it can't sustain that, that's when you have that blurry vision. So I would suggest that you should also have an eye examination. You probably need a refraction so that the eyes can rest a bit. So I hope that answers the questions.
Yeah, thank you very much, Dr. Mary, for the responses. We still have more hands, and I think we have a couple of questions in the chat box too. But I want to invite Professor Ibukwe to ask this question or pass his comments. Prof.
Okay, thank you. Thank you. I was having problem getting my microphone on initially. I hope I can be heard now.
Yes, we can hear you.
Okay, I have similar problem with what somebody had asked earlier. When I use the computer for quite some time on my phone, I start having something like as if there is pepper in my eye. And again, when I walk on the streets, I'm not able to get some images properly focused. So if I'm seeing having a global view of something, some parts of it could be clearly seen, and other parts cannot be clearly focused properly. But if I concentrate, the focusing will now return. So I went to the hospital and asked them what it was. They said it was my accommodation, just like she had already answered. I had my refraction checked, and they said it was okay. But it still comes from time to time, and I'm understanding that what I need is resting the eye sometimes. But another information I have now that I want you to clarify is that I noticed that this problem of that lack of focus comes when the sun is very, very bright, like in the afternoons. So does it require that I start using dark glasses? Or what do you think is actually the problem? But I can note that this is the digital strain syndrome from what you have presented. Am I right about that? Thank you.
Yeah, thank you very much for the question. Reading through the chat box, Dr. Musa Imam posted a question. He said, can we have any app or software that can be installed on our computer or phone, which will pop up a reminder at every 20 minutes that will assist us to adhere to the 20-20-20 rule? Dr. Mary, do you want to respond to some of this?
Okay. Where's that? Hello?
Please, those that are not speaking should mute themselves.
Okay. For the research, you experience more of lack of focus in bright lights, and so should you use dark glasses? Well, generally, I already advocated that sun protection is important for our eyes. So if you can get sunshades to wear when you're in bright light, is good for your eyes. So yes, you can wear it. But the reason why you may actually experience problem is maybe dark adaptation. Maybe you're coming from a room that is not a place that is not so bright, and then you come out to a bright place. Your eyes have to refocus for you to see better, because some changes happen to your pupil when you are moving from a dark place to a bright place, or a bright place to a dark place. So that can be it, but you can actually use sunshade when you're out. Then the computer test, are there apps? I think there are, although I have not used them, but I think there are apps that can be found that you can install on your system that will remind you that you've spent 20 minutes reading, you should look away. So I think there are. Then is there a question? Okay, can blue light from screen damage the eyes long term, and how can students protect themselves? Yes, there has been a lot of issues about blue light from screen, and then people talked about wearing blue coats, and a lot of money is being made on blue coats and all of that. But there's really no evidence that shows that the light is damaging the retina. No, there hasn't really been any evidence of that. So generally, I don't even prescribe blue coats, but people are wearing them because they say, oh, there is this, that. It's extra money. What I can say is, if your vision is still quite good and you don't need a lot of illumination to read, you don't have to put your screen on the brightest for you to see it. But there's really no evidence at this time that blue light from screens are damaging the eyes long term. Okay, how does using screen in a dark place affect the eyes? Because most people feel like it's more comfortable to use screen in a dark place. Well, maybe it's because you have adjusted to it. If you don't really read in a dark place and you on your phone or light to read in the dark place, even normally, some phones, immediately you put them on in the dark place, it will dim the light on the screen for you, and you may have to increase it. So using a screen in the dark place is because it affects the accommodation complex of the eye. So you actually put your eye at more work when you are looking at things in the dark. You are looking at a screen, every other place is dark, but just your screen is bright and they are looking at it. So you actually put your eyes at more work and you will experience more digital strain when you do that. So that's why we advocate that when you want to read, the ambience light should be bright enough so that it's not just the light coming, it's not only just from the screen or from the phone. And so that way your eyes don't go into overdrive to work. Because initially you may not even notice that you are overstraining your eyes, but along the line you will start having discomfort, start having blurry visions. One day you're myopic, one day you're hyperopic. Your vision keeps fluctuating. And I've had a lot of, although this is quite common among young people in their late teens and 20s, having a lot of that coming to our clinics. Today we refract them, they are -4. Tomorrow we refract them, they are +050. And you're wondering why is their vision just fluctuating? It's because they've been misusing their eyes and their accommodation is just switching in bizarre direction. And sometimes they even go into spasm and then they're unable to shift accommodation from near things to distant things. So they can't see anything and they can't walk. So that's why we encourage that you don't use screens in the dark.
Thank you very much, Doc, for the responses. They are quite apt and very germane. I have like 2 questions here. One, we live in a society where people can just walk into any store or into any roadside glass seller and just buy glasses. And we know that today it is common among females when they want to, when they put on their outfit, when they dress every day, they want to take a glass that will match the color of their clothes. So what do you say to that? That's one. Then secondly, I noticed that there are some auto-corrective glasses that people sell today that whatever challenge you're having with your eye, when you buy these glasses, it can auto-correct what the problem is. What do you think about this too? Thank you.
Okay, thank you for the question. Buying glasses from roadside sellers. Well, if for presbyopic correction, that means people who are in their late 30s, 40s, who are having difficulty with reading, and they just go to a roadside seller and the person say, wear, and the person wears and starts seeing, oh, I can see very clearly. We don't have any problem against that because they are ready to wear near corrections that are available everywhere. You can buy them in stores. If you travel, when you go to Walmart and some other places, you can actually just walk to presbyopic correction glass session and you can actually buy. So there are those glasses that have +1, +2, +3, so that they're able to read with them. So near correction by the roadside, it's not a problem. If it's glasses that they're just buying frames for the frames and the lenses don't have any power in them, there's no problem with that. Contact lens, people buy contact lens. Yes, we don't really have much of an issue with people buying contact lens, but where you buy it from, buying a contact lens from a cosmetic place may actually put people at danger of having infection when they wear, because those lenses are probably not kept well, and then somebody puts it on their eye and they are at risk of having infection. But if such contact lenses, whether it's for fashion or anything, is bought at an eye place, maybe an optometrist shop, you're sure that the hygiene process is a bit better, that is something that they can use. But if they notice redness, they have to present immediately, because visual loss from infection is real. Autocorrective glasses, I'm not sure I really understand what you mean. Is it that you just wear the glasses and then the vision gets correct and you don't have to wear them ever again? Or I'm not sure.
Yeah, in a case probably somebody has myopia or the other can't see far objects or close objects, and there's a glass available somewhere, it can correct the vision, whether near or far. By the pause, I have seen such that people say there are autocorrective glasses that can correct such conditions.
And then they don't wear glasses after that?
No, they keep wearing the glass.
Oh, okay, I get you. Okay, so the person is just getting prescription glasses from somewhere. It's possible some people have simple myopia or simple hypermetropia, so that there are no cylinders to say, oh, you need to align the axis for them to see. It's possible for such people to pick a lens, a +1, maybe their refractive error is +1, and they wear it and they're okay. Now, the catch in that is that if someone has, let me say, simple myopia, the person is supposed to be wearing 250, and the person minus 2.50, and the person now goes to a place and they give the person maybe -3, the person wears it. At that instant, the vision becomes very okay and the person is happy, goes home. The possibility of having headaches with constant use of it is there, because in that instance, such an individual has been overcorrected, and myopes don't tolerate being overcorrected well, so they may be having strains because they are using the glasses. They start having headaches, and they are wondering every time they wear the glasses, they have headaches. So for refractive errors, I would actually encourage that people have a proper refraction before you can get, refractions can be done in any optical shop and get the right glasses that is appropriate for the person. But if it's things like presbyopia, you just need glasses to read. You don't have any refractive error, just presbyopia. Your eyes are aging and you need an ad to read. Those can be bought from roadside, they can be bought anywhere. It's okay. Person can wear it. It doesn't really cause any problems.
Thank you very much, Ma. I think it's been a long day, but there's one more question on the chat box. Maybe we can take that before we call it a day after a vote of thanks from Professor Kennedy Shorter. The question on the chat box reads thus: that good morning and thank you for the presentation. What could be the relationship between cooking oil we eat and the health of our eyes? Thank you.
All right, thank you very much. Palm oil is said to have some vitamin A. From what I have had, so taking palm oil, the normal palm oil we eat in normal food is fine. There are some vegetable oils, so that cause all this either different kinds of what they call them, saturated fats, unsaturated fats, all those kind of things, like especially all those animal fat oils. They are said not to be healthy for the body. They are also not healthy for the eye, because once there's a problem with lipids in the bodies, if someone has dyslipidemia, there's a problem with the proportion of lipids in the body. It can also cause some problems in the eyes, as I said earlier, age-related macular degeneration, can even worsen diabetic retinopathy, and all of that. So it's actually once you are using an oil that is heart healthy, like there are so many studies talking about oil. They say olive oil is the best, just that it's a bit expensive because of the proportion of fats in it. So if you use an oil that is healthy for your heart, that oil is healthy for the eyes. So that is basically that's what I would say about cooking oil and the eyes.
Thank you very much, Ma. Thank you so far. We really enjoyed your presentation, enlightener, and it has been exciting, interesting, and wonderful. I want to invite Professor Kehinde Shweton from the University of Ibadan. He's one of the admins on the AfriScience network to deliver the vote of thanks before we call it a day. Thank you.
Thank you very much, Dr. Odetokun. So on behalf, please, can everybody hear me?
Yes, we can hear you, sir.
Thank you very much. On behalf of the AfriScience Network administrators, I would like to appreciate our presenter for webinar 34, Dr. Mary Ugalahi, Associate Professor, Department of Ophthalmology, College of Medicine, University of Ibadan, and consultant ophthalmologist at the University College Hospital Ibadan. Thank you very much for your presentation, which has been a good one and a community service to the academia. Title Clear Sight, Bright Minds, 2020 Vision for Academic Excellence. We have really gained a lot. Thank you very much, Ma. We wish you greater heights in your academic and professional pursuit. So to the participants, we want to say thank you very much for participating in this webinar. We hold this webinar every month. So this is webinar 34. Webinar 35 we hold next month by God's grace, October. And when the advert is ready, we will share it on all our platforms. Thank you very much. Dr. Mary, we don't know whether we'll be able to access your slides because from time to time we have people that couldn't join the webinar live, maybe due to time zone or other engagements. They normally request for the slides if it's available so that we can share it on all our platforms. Thank you very much.
I'll send this, sir.
Okay, thank you very much, ma'am.
Great.
So,
and we want to crave your indulgence to share the presentation on our YouTube channel. The AfriScience Network has a YouTube channel, and we encourage every person to subscribe to the channel so that they can have access to all the lectures that we have had in the past, including this one. So we want to do that too. Thank you.
That's awesome. Thank you very much. I'm grateful for the opportunity.
Yeah, thank you very much. Yeah.
So this brings us to the end of this webinar. I wish every one of us a wonderful weekend.